journey really started when I first met Amba. She's a little girl with CDKL5. I met her 7-8 years ago, and she was diagnosed with CDKL5. And I got interested, and I want to learn more about since then, because Amba had a lot of problems. So I wanted to have answer for all her problems, and I've been looking after her since then. We had about 44 patients in this study, and it's probably one of the largest study in CDKL5 in literature. A lot of us medical professionals don't know which medication is the best for these patients. There hasn't been any trial to compare drugs because it's very rare. It's a very small group of patients. So we asked the parents to see which medication is most effective. And very interestingly, a lot of them reported vigabatrin is the most effective anticonvulsant medication for their epilepsy. This was not something known before in literature. So it is interesting to know that vigabatrin is the most effective drug in this group. VNS is a small device. It's a battery-generated device, and it's put under the skin in the chest. Okay, and this device is connected to a wire, and the wire is connected to a nerve in the neck called vagus nerve. So this device generates impulses to the vagus nerve, and it controls epilepsy, stops seizures. We don't exactly know the mechanism, but it has been used in different types of epilepsy, not only CDKL5. And interestingly, 75% of them reported positive response to VNS, and very few of them had side effects, and they were not significant side effects. They were all manageable side effects. The second point, I want to know whether ketogenic diet is good for this group. Again, ketogenic diet is a special diet. It's used for management of epilepsy. So 12 out of 44 patients responded good response to ketogenic diet, and it's interesting to know that these patients do respond to ketogenic diet, and not a lot of them had side effects due to this diet. What was interesting, my patient Amba, the little girl, always had problems with their heart, and we didn't know that this condition is linked to heart. Nobody had reported this previously. So I asked the question whether these people with CDKL5 ever had any problems with their heart. Very interestingly, 12 out of 44 reported arrhythmia, which is funny rhythm of the heart, had arrhythmia, and Amba had similar problem. So there must be something, there must be some connection between this condition and heart problems. With this condition, there's a faulty gene. There's a mutation in this CDKL5 gene. And if we are able to fix this fault, then we should be able to correct or reverse all the problems people have with this condition. And gene therapy is becoming very exciting nowadays, and is becoming very topical in the last 10 years. And I'm very hopeful that in the near future we'll be able to explore and maybe use this option in children with CDKL5 and see whether we can reverse this condition. We can fix the faulty gene they have.